in touch with your treating team. Of course, it seems like, oh my God, this is like never ending process. I finished my treatment, but still I'm supposed to go meet the doctor. It's only to make sure that we do not miss out on even smaller symptoms that you come up with. It's not necessarily that you should go through scans unless and until it's recommended by the consultant oncologist or even surgical oncologist, but at least going and meeting them, like how doctors, even in the for the previous questions, answered about symptoms that you need to pay attention to. All of this can kind of make sure that your logical mind is working more than your irrational thoughts kind of taking control over your life. Also, the other thing is try and regain a sense of control over your body, especially like through exercise and diet. Focus on enjoying life rather than trying to see, oh my God, have I got something? So, the more you keep thinking about the negative symptoms, you kind of manifest those symptoms in you. You're not able to sleep well, you kind of are like obviously more so preoccupied rather than trying and being in the present moment. So all of this, when you try and do, it's like, what do you call it? It's easy to say but to do. But when you do it, when you try and give at least little, when you put a little bit of effort and make it into your routine practice, anxiety can be managed to a larger extent.
And does this anxiety reduce over time? Like with the time, does it go away or reduce?
Yeah, so it does not usually go away. So there's nothing like reduction in anxiety symptoms, but anxiety can always be controlled, right? Because what happens is there can be a lot of patients who come in with pre-morbid conditions where maybe their personality type is so much so like they kind of get triggered, they kind of worry too much on a lot of other aspects. So when it is a personality trait that makes this person feel more anxious, then there's no reduction, there's no cure as such when it is a disorder or like a pre-morbid condition. So we are treating cancer. Along with cancer comes anxiety. One, all it's like worry is always there. But when it comes to anxiety, if it's a personality type, then there's no cure for it. But obviously, it doesn't mean to say we've reached like the doomsday. There's no return. I'll have to always go through anxiety. It's not like that. But obviously, when you understand your nature, you understand how your coping mechanisms are. Some people go into this maladaptive way of coping. Now, for them, it's about changing or rather retraining them to cope in a healthier manner. Once healthier coping mechanisms are taught and practiced, anxiety can always be kept at bay. So, the key point here is it will not reduce, but it can be controlled. And understanding the nature and playing according to what you have always been practicing, and little modifications in the way you cope can always help in preventing panic attacks or serious episodes of anxiety.
Thanks.
Add, madam. What
Sure.
I see from my practice is patients are very anxious as soon as I diagnose. And the anxiety goes on till they finish the first cycle of chemotherapy. Once the chemo is done, they feel, oh, it's nothing, it's just saline. So the anxiety drastically comes down. It's not the same as they were before. When we start therapy and when we start explaining, and as the days go by, as madam said, it gets controlled automatically. So anxiety levels, it keeps coming down day by day. And as they keep coming to us, and when they keep talking to the other patients who are on follow-up, the patients who are long-term survivors, when they see, then the confidence automatically boosts up. So I can say as time passes by, anxiety levels definitely go down.
Absolutely.
Right. Sorry, Urvi, go ahead.
Thank you. Yes. So the next question is for Dr. Kripa. Like part of it, Dr. Gautam has already talked. Yeah. I was saying the next question is for Dr. Kripa. Dr. Gautam has already talked about it, but if she wants to add, like, what monitoring should the survivors do for the recurrence, and which specialists should they see, and the frequency of visiting the specialist?
The best person to know the recurrence. Am I audible now? It's clear, right? Like I made those open. So the best person to know the recurrence is the patient herself. So monthly breast monitoring, as sir suggested, monthly patients should undergo self-test examination at the opposite side as well as the opposite breast, both armpits as well as neck. So armpits, both breast as well as neck has to be monitored monthly once per patient during baby. So that is the most important step. Whenever she feels any lump at any site, patient has to visit the doctor. Or any symptoms are suggested before, she can come and meet the doctor. Better for to meet the treating oncologist who treated the patient prior. Any surgical or any medical oncologist is fine. The unfortunate thing is most of the patients will go to gynecologist. That's a big no-no. They have to meet the oncologist only.
Okay, that's a very useful point
Right.
that you made. Yep.
Yes.
Go ahead, Urvi.
Yes. Yeah. 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 So I would like to ask Dr. Meher that like changing to organic diets or dairy-free, sugar-free diets, does this thing help and the lifestyle changes and all?
Madam, actually, there is no strict correlation and there are no strict studies showing correlation between diet and breast cancer recurrence. But definitely, obesity has a role. So, obese patients, when the patient puts on more weight, it's not good. There's chances opposite breast recurrence when the patient puts on more weight. So, indirectly, if we say more sugars, more calories, it might lead to weight gain, obesity, which is risk factor for recurrence. So the weight should be under control. The most important point is weight. Second most important point is exercise, which we'll be discussing. So reduction in calories or all these sugars and all is important to control weight.
So I just have a point to make. So there is a very common myth that cancer patients should not take sugar. So I will say this is a myth only. They can take sugar. There is no problem in that. And secondly is that they go for Google and say that dairy products are not to be used in cancer patients. And that is also totally myth. Dairy products are not contraindicated in cancer patients. You should actually take more dairy products because they are protein rich. So these two myths are to be abolished.
Thank you. Thank you. Yes, I think that's very important, especially given the, as you said, these are protein rich. Yeah, go ahead. Would we continue?
Yes, so I'm done with the.
Oh, yeah. I think Dr. Meher, you were also going to talk about the exercise, workout, and yoga as well, right?
Yes,
So,
yes, it's very important, madam. It's very important.
Yes.
Healthy lifestyle habits are very important, not only for cancer patients, for
correct.
everybody,
For everyone.
and
Right.
most over for cancer survivors, because to prevent recurrence. It's very important to maintain a healthy lifestyle habits, exercise at least half an hour every day. This because it keeps a hormonal balance in our body. So
Right.
exercise is very important, not only to prevent other diseases, but also for recurrence. And exercise also keeps obesity under control. So it's not a diet, especially as sir was saying. It's on the whole, it's to keep the obesity under control. So for this, lifestyle habits, including food rich in fruits and vegetables, regular exercise, and adequate sleep. When we talk about lifestyle habits, we talk about all three: the food,
Right.
exercise, and sleep. Yes.
Right. I think I'll also take in at the moment. We've got two questions that have come in. I'll ask the group. One is, I'm a BRCA1 breast cancer survivor, recently finished, this is the second round of cancer treatment, bilateral mastectomy and chemo. She had first round about a few years back. Do I still have risk of recurrence? That is one. And second, do BRCA1 women pass, is it genetic? So will they pass it on to their children?
Can I take this question?
Sure.
So the first question is BRCA positive children bilateral mastectomy as well as hysterectomy or only mastectomy? If ever she underwent only mastectomy, the chance of getting breast cancer recurrence will substantially decrease, but still she'll have a risk of having ovarian cancer.
Right.
So, better she undergo bilateral mastectomy and risk reducing salpingo-oophorectomy. So, if ever the surgery got done, then substantial reduction of risk is there for the recurrence. The chance of recurrence is like very minute. And the
Right.
second, the chance of inheritance to her offspring. So, if patient is BRCA positive, there's 50% chance that she will inherit her gene to kids, offspring. If she is positive, at one point of age, her kids also should get tested. And further, the kids should plan pregnancy as per the IVF and deletion of the embryos who are BRCA positive.
Right.
So, 50% chance of passing her gene to kids.
And I mean, so the normal assumption is that you're only passing, the inheritance is only to the girl child, but is it also to the male child?
Yes.
So the male breast cancer is also 5% chances there. Prostate, male breast cancer incidence is there. More than that, if male child got acquired BRCA from the mother, there is a possibility that he will pass that BRCA to his kids. So not
Okay.
only affection of 10% for pancreatic, prostate, and male breast cancer, but also he will pass this gene to his next generation.
Right. Okay. Thank you. And one other question that's come in on Zoom: what precautions HER2 positive survivors should take? Is there anything specific that HER2 positive need to take?
No, madam, nothing specific. It's just as I said,
Right.
they need to be more vigilant and regular exercise, healthy lifestyle habits, the same.
Okay, thanks. All right, so let's look at, we will take, I think, a couple more questions later. Let's look at the management of, when the breast cancer does recur. Is the treatment of recurrent breast cancer the same as first-time breast cancer, Dr. Gautam?
So the treatment of first time breast cancer usually involves, if it is a localized breast cancer, usually involves surgery, radiotherapy, chemotherapy, plus minus targeted or hormonal therapy.
Right.
That is broadly. So
Right.
now when the recurrence happens, it can be either localized, which is very, I don't say very uncommon, but it is less common, and it can be distant metastasis, means it has gone to other organs. That
Right.
means it is a stage 4, which is more common type of recurrence. So now when it is a localized recurrence, we can still work out for surgery plus minus radiation plus minus chemotherapy. But if it is already distant recurrence, then most of the time there is no role for surgery. Then you have to go for the chemotherapy or targeted therapy or hormonal therapy. Now, the second main thing is, when it is first time tumor, then our intention is mostly cure. So
Right.
when I'm trying to get my patient cured, I want the best benefit of my treatment. So you usually give full dose of therapy and you take care of the side effects.
Right.
Now, when the tumor has recurred, now most of the time you understand that you may not be able to cure this patient. Now, when I am looking for only control of the tumor, my priority will shift to quality of life and prolongation of life as compared to cure. So when I am looking for quality of life, my treatment will be slightly milder so that there are no major side effects and the patient is able to live a good quality of life. And
Right.
secondly, when it has recurred, then most of the time, unfortunately, it becomes a cycle that you give treatment, the disease gets controlled, and after sometimes it again progressed, and again you give the next line of treatment. So the main is intention becomes cure versus control, and first you are going for the full full throttle as compared to then you look for the quality of life and the prolongation. This is
Right. Okay. Also, Rajeshwari, emotionally recurrent, even though in one sense people assume that because it's, you've been through it once, recurrent is not so emotionally challenging. But in our conversations with various survivors, we find that actually it comes as a huge blow when the recurrence actually happens. So what's your advice? How should they and their families especially manage that situation?
So thanks for the question. I think it's definitely important to bring family also into the whole picture, considering when you go to the hospital, when you're getting treatment as the first line of choice, there are a lot of attention given to the patient, and then obviously the caregivers get sidelined to a larger part of it. But when the recurrence happens, because of the fact that there's already underlying stress that's not being treated well, so family tends to get also equally affected as much as the patients do get affected, considering there's a lot of role changes that happens. There's a lot of friction between roles. The primary breadwinner might not be the one who is going to continue to be the primary breadwinner. So given all of that, there's a lot of commotion emotionally. So the first key here is definitely to sit down and analyze what your emotions are. So you move from this fact of being under the shock, denial, you move into accepting the whole fact that this has occurred. Now, once the emotions are kind of in place, you've accepted the negative emotion, whether it's fear, worry. There could be a lot of financial pressure and concerns as well. Some insurance company do not kind of completely take care of the treatment, the second or the third line of treatment. They don't usually fund fully. So then there's a lot of other things that gets into planning. So and emotions are kind of like intertwined with your physical changes, practical related distress, and also financial concerns. So the first key here is to accept those emotions that are coming in line and don't feel guilty. Like, did I do something wrong? I shouldn't have maybe gone to work. I should have just stayed back. I should have taken care of the patient. Or the patient might feel, oh my God, I ate that one chocolate maybe. Or maybe I indulged in a lot of thing that gave me so much pleasure that I completely kind of cut myself away from the medical team. So like I said in the previous point, I said enjoy life. But again, like I also said, it's about taking that proactive step in medical care. So don't feel guilty, get comfortable with your emotion, accept the phase, communicate what's happening, understand strengths and weaknesses of the family and the patient, and try and see how you can strengthen those resources. Allow people to help you at this point in time. Don't kind of feel that, oh, what if I ask for help? The other person might feel burdened. So that kind of a thought, if you're able to kind of talk to them about all of these things, then automatically there's formulation of plans. It could be weekly cycles of chemotherapy, or they can be palliative intent of treatment where symptom management is the only thing. So when you kind of understand from the doctor what his or her goals of care would be, then you also sit down and formulate your plans accordingly. Get your facts right. Like I always say, don't Google search, talk to experts. It's okay to ask the same kind of questions in different forms to the same person or your team members. They kind of help you to understand it in a much better way. Prepare a plan for emergency, especially. You think that the disease is kind of progressed, or it's record and it's kind of progressing, it's aggressive, then there's always, it's important for us to, once you formulate plans, to have emergency contact numbers made available. Talk to your family members or your acquaintances who you think can kind of help pitch in or contribute in any form, and keep them posted. You don't have to always keep talking about your disease recurrence every now and then to so many people that are coming in. Talk about your hobbies, invest your time in doing things that give you happiness. Seek professional help, even though you are into the survivorship period and you've gone through recurrence, because of the fact that you've started right in the beginning to seek professional help. It comes a longer way because you would have understood, corrected the mistakes, maladaptive coping styles, for you to start building onto that healthier style of managing your anxieties or even stress for that matter. So these are a couple of things that you can obviously try and practice little by little, and then it comes a little way.
Right. Thank you. Thank you, Rajeshwari. And we'll now discuss some of the myths that are there. So would we go ahead?
Myths. Yeah, there's a belief that if you have had a radical mastectomy, the risk reduces, like risk of recurrence reduces. Dr. Kripa, can you talk about it?
So radical mastectomy BCS as such, it depends on the decision regarding surgery will be taken as per the stage of the patient and the baseline by surgeon. So it's not that if patient underwent radical mastectomy, the risk reduction will be more, because the prior studies have shown there is no difference between breast conservative surgery and radical mastectomy. Only the requirement for radiation and certain things will be changed. The treatment part will be changed, but there is no difference in the risk of recurrence between two surgeries.
Thank you. Yeah, and next question is for Rajeshwari. She's already talked about it, but like there's a belief or the fact, I don't know, that stress is one of the reasons of getting cancer. I'm not talking about recurrence, but it increases the risk of cancer. So how to manage this stress?
Stress, I think, is a very broad topic that all of us go through stress, especially finding work-life balance. And no matter what job you're doing, it could be your hobbies, interests, passion can get converted into stress very easily. So thank you for that question, actually. But again, like here, leaving out the points I've already brought about in the platform, it's understanding first about what stress is. Stress is very individualistic. What I've seen in patients, especially when they come to undergo treatment, is they kind of tend to compare. Oh, you're receiving this kind of treatment, but I am getting this, but the diagnosis is almost the same. They don't tend to understand the differences between, or the nuances, or the small little things that make the treatment plan different for each of them. So when cancer treatment can be so kind of tailor-made, we also need to understand that stress at different levels are extremely individualistic. So things that I can get stressed about are not the things that another person can get stressed about. So the key here to manage stress is to stop comparing yourself with another individual. Also, the second thing is stop controlling the uncontrollable. You cannot do anything about a lot of things in the environment. So instead of comparing and instead of trying to control the uncontrollable, we'll have to channelize our energies in a form where we get more results out of, or the outcomes are going to get much better. And the other thing is, it's okay to not be okay. So the minute we tend to always try to be happy, we need to be always okay, we need to be there for another person, that can cause a lot of stress to an individual, knowingly or unknowingly. The third factor is compromised self-care. Once people usually finish treatment, they tend to say that, okay, now I'm all right. You've given me enough care. Now it's for me, the time has come that I need to do something for other people. I think when we compromise on self-care, like also Dr. Meher was also mentioning that how eating, sleeping, and exercising is important. When we also tend to compromise on self-care, that can lead to chronic stress. And chronic stress can always lead to falling ill, catching a lot of, extremely getting into chronic pain kind of a thing. So I think self-care is, again, an essential thing that we need to follow. Saying no to alcohol and tobacco use definitely plays a key role, because people tend to believe that consuming alcohol and tobacco can relieve you from stress. Maybe, yes, as a short-term goal, if you look at the pleasure that one may derive from using tobacco and alcohol, the longer-term use of this is extremely harmful. So these are maladaptive ways of coping. So that's the reason why we, even during our sessions when we meet patients and family, we tend to analyze their coping strategies. And if we find that they are investing a lot of time in maladaptive coping styles, then we tend to rectify them and give them a platform where they can try and practice adaptive ways of coping. Two other major points in terms of managing stress is definitely, apart from seeking professional help, we'll have to get our life into routine. When the routine is gone amiss, then because there's a lot of chaos and havoc that's happening, Shifting from one role to another can cause a lot of stress. So get yourself into a routine. The last thing is find meaning in what you do. You don't have to do something because somebody has told you to do. Say, suppose your doctors have told you do, or they've given you a care plan. Rather than following it very ritualistically, try and see why they've told you to do a certain thing the certain way. And when you find meaning in your life, stress automatically gets to a lower platform. I'm not saying you will live a life that's stress free, but you will also understand how to handle stress. I think the key here is handling managing stress so that it doesn't get into another complex kind of a issue. So that's how you manage stress.
I would like to add one point here. Is it okay?
Yes.
Thank
Yes.
you.
Sure.
As Rajeshwari mentioned, the cancer Tyler
Yeah,
made
yeah,
it
please.
common in a clinic to see a patient running for a second opinion that other patient got injection for 1 year in USA. My cousin got injection for 1 year in USA. She's getting tablets. I didn't get treated properly like that. So the patient themselves, they should get assured about the treatment is getting in right direction. So that's the main thing from clinician's point as well as any psycho-oncologist point to clear that they're getting a treatment in right direction. Especially in breast cancer, different types of breast cancer, this is different types of treatment. It's a very common problem to get stressed.
Right.
Yeah, yeah. I have crossed this 5 years window. Can I now relax, Dr. Gautam?
Yes, ma'am, you can relax. That is the only answer to decrease your stress.
Thank you.
So yes, I will say the patients that they can relax. They don't have to be so much vigilant as they were in the first 3 years of their life. But yes, a follow up every 3 to 6 monthly, maybe mostly 6 monthly after 5 year, or maybe once in a year, plus a self breast examination. Tell them. So that is the only one thing: self breast examination, and try not to overlook anything. These are the only things. And yes, they can totally relax. I think the morbidity
Thank
of
you.
the stress they will be taking is more as compared to getting relieved. So, or the lie which I am telling them that they can completely relax. But my words are usually these, that they can completely relax.
Right.
Thank you.
So let's look at some of the quality of life. And we had, in fact, one question which has come up that, I am a 5-year survivor of breast cancer, but I'm struggling with lymphedema. And I think that kind of leads in very nicely, Dr. Meher, with the question on, what are some of the comorbidities and side effects that breast cancer survivors live with and what they should be careful about.
Yes, madam, as you said, there are certain things which the patients need to be careful starting from day one. Day one.
Mm.
As you're saying, lymphedema, that's a very, very important issue where prevention is the only way of treatment. We don't have a proper treatment for that. So prevention is the only way. So we need to educate the patients. We start educating from day one itself. That, for example, make sure you don't injure the hand, not to strain the hand too much, regular exercise. The arm which on the side which where we undergone surgery, they need to do regular exercise. So lymphedema exercise and education about prevention of lymphedema is very, very important. This we usually start from day one.
Mm.
And second most important, the complications of therapy, where some drugs have effects during treatment, and some have long-term effects. Long-term effects, like some drugs have some, patients can have tingling and some stinging sensation in the fingers and hands, which might remain for years together.
Right.
So some can have some sensation at the site of mastectomy, where they undergone surgery. They might feel discomfort. It is because the nerves get cut and all. So all these, with proper education, patients can get over. And other thing about the quality of life is the looking at the other organs. Breast cancer patient, once the treatment is done, is also like any other person, any other individual. So they also need to undergo periodic checkups for cardiac checkup. They need to put their cholesterol under control, their sugars under control, their their blood pressure under control. These are, I feel, that ignored. Most of the times the focus is mainly on cancer, leaving other things. But as we need to see the person as a whole, that the treatment of cancer will be done in 6 months to 5 to 6 months. But the patient, when we are expecting a long life, so he's also likely to have other things which normal people will face. So
Right.
putting cholesterol under control, putting sugar under control, the diabetes under control, hypertension. So all these factors need to be understood, and the proper precautions need to be taken. And some patients are on tablets for a long time, hormone therapy for around 5 to 10 years also now, where the bones might get weaker. So as Dr. Gautam was saying, again, calcium-rich foods, again, regular exercise, and certain medications for a good bone health. See, overall, so every system needs to be taken care of. It's just
Right.
not cancer itself. Once the patient is treated or cured of cancer, again, the next point is like any other human being. Again, regular lifestyle habits, the modification, and to prevent other diseases. All these need to be looked at.
Okay. Thank you. Urvi, anything else that you want to add or? No. Okay. Dr. Neera, before we wind up, how is the industry supporting breast cancer patients? Because access in a country like India is a huge challenge, and financial access is obviously a big factor. So yeah.
Thanks, Aparna, for your question. I will pick up from where we began. So Dr. Gautam said, being treatment compliant is very, very important to prevent recurrence. And the quality of life that each patient looks for. So today is the era of value-based medicine, what we talk about. Patients want more health for the money what they spend. And that can only come when, as busy practitioners and oncologists, we pay more time, we take inclusive decision-making in interest of patients, and we make a shared decision by informing patients. So how as industry is contributing to the cause is that we are trying, there are a lot of targeted therapies that have come up. There are genetic testings, which in the beginning we talk about, like HER2 positive cancers. There are specific drugs which are available for this kind of treatment. And the originator molecules are very, very expensive. And if you see, still more than 50% of the patients, they are not able to afford that treatment in spite of having so many versions of that innovator molecule being available. But when I talk about shared decision making, when we explain to our patients, see, this is the innovator molecule. There are other molecules which are available, though they are a little less expensive. But how we help patients to take a decision is, this is the best, near similar, the closest to the innovator molecule which is available and has proven in terms of large global trials, in terms of volume of evidence that has been generated on that biosimilar molecules, is so much to bring the trust so that the patient can be involved in taking their decision in their interest, that this is the best. If I cannot afford the main molecule, I can, which is the next second closest to the innovator. So once we give them that confidence that yes, this is a global molecule approved across the world, US, EU, Canada, Japan, Australia, that builds a lot of confidence so the patient can make shared decision making in their interest. And because it has a robust data, that helps patients to bring the quality of life automatically. That's where we talk about cost effectiveness. The money the patient is spending, he's getting the added quality of life for themselves. And that's how we need to make them
the drug accessible and affordable. As industry, we have brought a lot of such biosimilar molecules. One of them is the trastuzumab biosimilar that we have got, which has global approvals. And if patients know a little more about that what kind of a quality this drug brings to them for HER2 positive cancers, they can also join hands with the treating oncologist, that this is what my decision is, this is what I can afford, and that's what I want to go for it. So bringing those molecules, better quality versions of the drug, helps patients improving outcomes and prevent recurrences. So as industry, we are contributing to the cause, making quality, affordable drug options available to these patients. Thank you.
Thank you. Thank you, Dr. Neera. Any final words, Dr. Meher, before I do the roundup?
A very important point where everybody needs to understand is the alternative medications where patients are adopting. What I find especially in recent 1-2 years, is patient taking some jadi buti, I can say, or some Ayurvedic preparations where we don't know the composition. They try all the methods and then they're coming to us. Somehow these medicines are making the cancer resistant to therapy. So the studies will show certain outcomes when we use certain drugs, but this is not being followed, or this cancer is not obeying our rules when the patient is already taken some form of alternative medication. So my request in all the forums whenever I speak is, never take any medication for which we don't know the composition.
Correct.
Go for the best possible treatment. We cannot say anything for a rainy day in cancer. So the best option should be the first option. So seek medical attention at the earliest, so that we need not lose that golden hour.
Right. Dr. Gautam?
Ma'am, my viewpoint is slightly different. As started in my initial practices, I was also very much against the alternative form of therapies. But frankly saying, if I have a cough, before going for the allopathic cough suppressant, I will try my Hicks and Nicks, what are available at the home remedies. That is happening with all of us. So when my patients do take alternative form of therapy, I try to explain them, but I am not totally resistant to them. That is what I have grown with the my practice. So we must understand that they are a part of their lifestyle. They are a part of our lifestyle also. So we should not be very much rigid to accepting that they are taking an alternative form of treatment with our treatments. Yes, the composition matters, because sometimes they take a very different set of medicines which can have a lot of side effects. But I'm slightly more adaptive to their viewpoint in alternative medicines also.
I think the point that is being made is that you should know the composition, right? So if it is a home remedy, it's very different because you know exactly what the composition is. But Dr. Kripa, any final words from you?
I would like to add what Dr. Meher and Dr. Gautam Goyal said as per my experience. I've seen in Tata Memorial Hospital, Mumbai, lot of patients from especially UP and Bihar, where there is education is not so rampant like other states. Once they got detected with breast cancer, they used to start the native medicine, alternative medicine, and they used to time pass like 3 to 4 months, and they used to come with locally advanced and metastatic state. And not only that, once they got started with chemotherapy, they used to continue the alternative medicine also together. So lot of liver toxicity as well as kidney toxicity we used to see. So it's not wise to delay. It's better to consult a doctor as soon as possible and to start treatment. I agree with Dr. Meher what she said. We should not use alternative medicine along with the chemotherapy drugs. And also a lot of patients used to buy graviola fruit to delay the ovarian cancer, uterine cancer, breast cancer as a part of prevention. There is no evidence as such. You have to meet a qualified person to know the evidence.
Thank you. Thank you, Dr. Kripa. Rajeshwari, any final words?
So as much as everybody gives importance to physical health, I think mental health also needs to be given equal importance, because Like also, like we were discussing about what anxiety can do, what stress can do. If you're able to handle them when it is smaller, it's always easier for us to kind of come out of the maladaptive way of coping styles rather than allowing it to grow and become a disorder on its own, or any illness for that matter, and then going into getting yourself treated by a psychiatrist. I'm not saying that you shouldn't go meet a psychiatrist, but all I'm saying is if you're able to come and get help when the problem is smaller, you're able to avoid a lot of more things that can come your way. So I
Right.
think a holistic way of looking at it is not just treating cancer in its physical form, but also when you give importance to mental health and support at the right time, a lot of things can be in control, and the fighting of cancer can also become more positive rather than trying to look at it as a curse, or rather, I'm facing the brunt of my karma and all of that. I think those things can get avoided. So I think the final word from my end is give importance, equal importance to mental health as well. That's it.
Thank you. Thank you, everyone. And thank you for our audience to join. I think there were very few, very important messages that came up in this session, which focuses on be vigilant, but be positive and hopeful. Clearly, the message is that early treatment is a very good way, or the best way, to reduce recurrence. And also the golden hour, in a sense of, don't delay treatment. I also liked Rajeshwari's point of stop controlling the uncontrollable, focus
Yes.
on what you can control. So eat healthy, exercise, you know, practice all of those mental health aspects of, train your mind to reduce the stress or manage the stress. And all of these things will eventually reduce your risk as much as is possible. So thank you once again, and thank you to our panel for spending this afternoon explaining and addressing the various questions we've had on this topic. Thank you.
Thank you.